I'm Leon Scott of Cloud9 Fitness, the personal trainer's #1 resource for continuing education credits. And today we're in downtown St. Louis at the Fitness Factory, bringing you the first of Cloud9 Fitness's video workshops. Today, our focus will be on the rotator cuff and shoulder complex. Have you or any of your clients ever complained of functional shoulder pain? Or have you ever injured your rotator cuff in sports activity? Today, we're going to figure out the cause of that pain and how to improve it with specific exercises. Let's go to our visual models. When you look at the shoulder complex, you see the humerus, the clavicle, and the scapula. The shoulder joint is actually known as the glenohumeral joint because the humeral head articulates with the glenoid fossa of the scapula. The humeral head sits in the glenoid fossa. When the scapula is upwardly rotated, the bony support from the glenoid fossa is increased. However, the humerus would still fall out of the socket if it wasn't for the supportive structures of muscles, tendons, and ligaments. The muscles that support the shoulder joint are the rotator cuff muscles, and they are the supraspinatus muscles, the infraspinatus, the teres minor, and the subscapularis. So what are the causes of functional shoulder pain? We'll focus on 3 today. First, if you have weakened or damaged rotator cuff muscles, the other supporting structures of the shoulder have to endure that increased stress. This can lead to inflammation. The second reason deals with the scapula. If it is downwardly rotated, the bony support is removed. This also increases the amount of stress on the supporting structures, which leads to inflammation. The third reason for functional shoulder pain relates to the movement of the arm. So let's go back to our skeleton. The deltoid muscle is one that abducts or laterally raises the arm. But in order to do this, the rotator cuff muscles actually perform the first 15 degrees of abduction. They also depress the humeral head, allowing the deltoid to complete the movement. With weakened or damaged rotator cuff muscles, the deltoid actually would jam the humerus into the shoulder joint, causing inflammation. This is the mechanism of shoulder impingement syndrome. Now, unfortunately, we put ourselves at risk for functional shoulder pain with the exercises that we tend to focus on in the gym. When you work out your lats, your rhomboids, your levator scapula, and the pecs, all of those muscles function to depress and downwardly rotate the scapula. In fact, there are only 3 muscles that upwardly rotate the scapula: the upper fibers of the trapezius, the lower fibers of the trapezius, and the serratus anterior, which lies on the anterior surface of the scapula and runs down over the ribs. So what exercises can we do that improve the strength of our rotator cuff and the upward rotators of our scapula, the trapezius and the serratus anterior? Let's look at a few. The rotator cuff can be strengthened with lateral rotation of the shoulder and scapular abduction. The serratus anterior, the strongest upward scapular rotator, is strengthened with closed chain upper extremity exercises like push-ups or shoulder circumduction over a Swiss ball. So use this information to improve your shoulder workouts. But remember, do these exercises at the end of your workout is to not excessively fatigue the supportive muscles in the shoulder. So look for more of our video workshops online. Or if you're a personal trainer in need of continuing education credits, visit cloud9fitness.com to review our set of comprehensive musculoskeletal and nutrition courses. Thank you.